Hi guys, today's topic about ranula. Ranula. What are the ranulas are? These are soft cystic swelling in the floor of mouth. These are bluish translucent in color. So ranulas are bluish translucent soft cystic swelling in the floor of the mouth, and they resembles with frog belly. Ranulas are look like frog bellies. That's why they call ranula. Ranulas are actually pseudocyst. What is the cyst? Cysts are epithelium lining cavity, but these are the pseudocyst. It means there is no epithelium. What they have is layer of granulation and fibrous tissue. Okay, so these are the layer granulation fibrous tissue. What in cyst? So if you see between pseudocyst and cyst, this is the cyst. Epithelium lining are the cyst. What what is pseudocyst? They are just lined by the fibrous tissue and granulation. Fibrous tissue and granulation. So these are the pseudocysts. These are the mucous retention cysts. What they contain? Mucus retention cyst. So these commonly found in the 10 to 20 years, means second decade is the common age group, and these are the common in female than the male. What pathogenesis? These are because of trauma of the duct of the sublingual gland. Trauma of duct of sublingual gland. That may be iatrogenic trauma or food or teeth induced trauma. They may be congenital abnormality, abnormalities of the ravenous duct. Ravenous ducts. These are the ducts of the sublingual gland. They may be caused by the HIV induced periductal fibrosis or inflammation, or they may cause by the infection of the this duct of the ravenous or sialoadenitis induced this ductal. What this trauma or congenital abnormality lead to the extravasation. Extravasation of saliva of the sublingual gland. What sublingual gland having mucus type of the saliva, mainly mucus that spread into the floor of the mouth, that lead to the bluish translucent swelling in the floor of the mouth. So this swelling, this is the mandible, this is the tongue, and between the tongue and mandible, these are the sublingual glands above the attachment of mylohyoid. This is the mylohyoid muscle. mylohyoid muscle. These are sublingual glands. So these are the duct of the sublingual gland, and these may form the cystic swelling like this. This is bluish translucent color in the floor of the mouth. This contains mucus. This is called ranula. If this ranula is above the mylohyoid, this is mylohyoid muscle in the floor of the mouth. This is called simple ranula. If this ranula goes below in the neck through mylohyoid muscle, then this is called cervical ranula or plunging ranula. Plunging ranula. So sometimes this may occur as an isolation, means there is no simple ranula. You can see only this plunging or cervical type of the ranula. Most of the time, diagnosis of simple ranula can be done by the clinical examination only. Only clinically you can diagnose this is the ranula, but in cervical or plunging type of ranula, you require most gold standard is MRI. By MRI, you can see cervical extension and this dumbbell of this mylohyoid muscle origin between this ranula going through this mylohyoid means you can identify the extension of the plunging type of the ranula. So this plunging type of the ranula or cervical ranula required MRI. You can do CT scan, ultrasound. In some cases, required FNAC to differentiate with other lesion like cystic hygroma, means other dermoid cyst or dermoid cystic lesion in the neck. So these plunging type of the ranula required some investigation. Otherwise, you can diagnose clinically. Now, what is the treatment? Treatment. Best treatment for ranula is the excision of ranula with excision of sublingual glands. So definitive treatment is the excision of ranula and with the excision of sublingual gland. There are very less recurrences in this part. Sometimes ranula are so extensive, it's going in the floor of the mouth and added with the lingual nerve and other Wharton's duct part that is difficult to remove, sometimes leading to extension into the posterior part of the floor of the mouth. In that cases, excision is not possible. Then you have to do marsupialization. Then you have to open this ranula like a book. Suppose this is the tongue, this is the ranula, this is the mandible. Then you have to open this ranula like a book. So you have to do this like and open like this and suture it. So this will hold like a open book. Then it will shed off. It means in difficult cases you can do marsupialization. For plunging ranula, you can do excision through transcervical excision. Transcervical excision in plunging type of the ranula. So this is all about ranula. Thank you so much.